Now for the big TB drugs. Guys, before we get into the drugs, we have the 5 TB tips. First is meds last 6 to 12 months. Guys, it's a long duration. Second is N95 mask is worn at all times. Third is that the family is tested for TB. Number 4 is sputum samples are done every 2 to 4 weeks. And number 5, 3 negative cultures on 3 different days means that you're no longer infectious. Guys, not 1 negative culture. The key number here is 3, and then you're free. Now, all these drugs are liver toxic, so some instructors use the acronym RIPE. R for rifampin, we call redfampin, since there's orange and red tears, urine, and sweat. Or we call rifampin, since your body fluids are red like a reef. Now, the 3 key points here is number 1, red and orange tears, urine, and sweat are normal. So teach patients these key words. Wear glasses instead of contacts due to the discoloration of tears. Huge NCLEX tip. Number 2 is oral contraceptives are ineffective. It basically deactivates the pill. So keywords here are use non-hormonal backup birth control. And third thing is monitor for jaundice since it's very liver toxic. That was actually an ATI question. Now, I is for INH, also called isoniazid. Now, this is the most tested TB drug, guys, so get your pen and paper, write these things down. We made this acronym to help you remember all the tested key points. So just remember the acronym INH. I for it interferes with the absorption of B6. Now, the key term is low vitamin B6, usually equals peripheral neuropathy. Since B6 is needed to develop the myelin sheath, which helps the muscles move, guys, we teach the patients to take vitamin B6 25 to 50 milligrams per day. Now, don't be tricked. Guys, it's B6 or B complex. Not folic acid, not vitamin D, not even B12. Guys, these are the most commonly chosen distractors. Only B6, so remember, get your fix with B6 or B complex. Now, N is for neuropathy, as mentioned before. Guys, the key term here is peripheral neuropathy. We are reporting new numbness, tingling extremities, and ataxia, basically the inability to walk. Now, H is for hepatotoxicity, aka liver toxic. So we're monitoring and reporting immediately these key terms. Jaundice or yellowing of any type to the skin and sclera, basically the eyes. Dark urine was a huge NCLEX tip. Big keyword to remember. Now, fatigue was mentioned in multiple content areas, as well as elevated liver enzymes, AST and ALT. Guys, we hold the medication. This is definitely induced hepatitis. And lastly, we teach no ETOH, or aka no alcohol, and limit acetaminophen. Huge common distractor to reduce alcohol consumption. Guys, that's a big no-no. We're talking 0 alcohol, 0 tolerance, so don't get tricked. Now, P is for pyrazinamide. Guys, this did not come up once in over 10,000 questions, so it's a nice to know, but definitely not a need to know. Now, E is for ethambutol, so we use the word E for eyes. Guys, the huge key point here is we report blurred vision or color changes. This information came up in multiple sections. So we teach the patient to have baseline eye exams and routine eye exams. Guys, big eye appointments for ethambutol. Now for the top 3 missed questions from this section. A patient is newly prescribed isoniazid, or INH, to treat active tuberculosis, that TB. What instructions are the most important to teach the patient? Select all that apply. Your favorite questions, huh? So INH, guys, is our acronym. I for it interferes with B6, N for neuropathy numbness, and H for hepatotoxicity. Guys, we're thinking about this before we even start looking at the options. So option number 1, monitor for numbness and tingling. Yes, guys, that is neuronumbness, and we monitor for that. Option number 2, report blurred vision. No, that's an ethambutol for the eyes, not INH. Option 3, use additional forms of birth control. No, guys, that's for rifampin. Number 4, avoid wine at night. Yes, always avoid alcohol. We're calling 0 tolerance for the hepatotoxicity. Option number 5, we notify the HCP if the urine turns dark. Yes, guys, dark urine is bad. Again, we're monitoring for that H, hepatotoxicity. And lastly, B6 daily. Yes, I is for it interferes with the B6. Now, question number 2 here. Which statement by the patient requires further teaching? Again, a select all that apply. So we're looking for the no-nos here, the incorrect statements. So number 1, yes, it's okay to have sex with lesions present while on acyclovir. Guys, no, that's a huge no-no. We're avoiding sex while herpes lesions are present. Number 2, it is normal for rifampin to cause red urine. Yes, guys, that's what we call it, red fampin. Totally normal for rifampin to cause red and orange body fluids. And number 3, it is normal for rifampin to cause yellow sclera, basically yellowing of the eyes. Guys, no, yellow sclera or the eyes usually means that it's jaundice, which is liver toxicity. So in any case scenario, it's not normal for any drug to cause yellow sclera. Usually mean, again, hepatotoxicity. Now, option number 4, I will take vitamin B12 on INH. No, guys, INH, we take vitamin B6. Now, our last question here. A patient with TB has been taking ethambutol for 2 months. Which adverse effect should be reported to the HCP? Select all that apply. Guys, before even looking at the options, we're saying ethambutol starts with an E, E for eyes, and the 2 biggest things for the eyes, blurred vision and color changes. So option number 1, red and orange tears. Guys, that's not ethambutol. That's normal for red fampin, those red and orange tears. Option 2, blurred vision. Yes, guys, report the eyes. How about 3, new numbness and tingling? Not ethambutol, that's INH problem. Option 4, there it is, the colored eyes. Guys, yes, the eyes again. And number 5, the elevated liver enzymes. Not an ethambutol problem, usually rifampin or INH. All right, guys, that wraps it up for anti-infectives. Make sure to download your study guides and take your quiz. Thanks so much for watching.